Good afternoon. My name is Chun Lo, and I represent Taiwan CDC. When I was asked to present on COVID-19 and HIV, I had to be honest that COVID almost had no impact on Taiwan's HIV programs. Because we don't have many domestic cases, we never had a lockdown. All HIV services like testing centers, ARV clinics, and hospitals remained open and was functioning as usual. So while you may hear lots of negative impact of COVID on the public health work of HIV, as alternative, I'd like to share with you an interesting twist seen in Taiwan, that is progress on U equals U in HIV decriminalization, which I put as positive momentum gained during COVID response. To begin with this topic, you see there is a law in Taiwan that has been there for decades, which punish individuals who know they are HIV positive but conceal the fact and had condomless sex with others. This behavior is deemed as a crime which is subject to 5 years to 12 years in prison. Furthermore, unaccomplished offenders shall be punished, which means even if the behavior does not actually lead to HIV infection of the other person, it's still a crime and an HIV positive individual may go to jail. This law, called Article 21 in Taiwan, basically defines the combination of HIV non-disclosure and unsafe sex as a crime. So far, there have been 20 cases of Article 21, of which 17 were declared by court as guilty. The average sentence was 3 years in prison. And of those 17 guilty cases, unaccomplished offenders accounted for 13 cases, which is 76%. These cases were a variety of specific scenarios. For example, it can be an ex-partner who already knew his lover's HIV status before the relationship, but after breaking up, the heartbroken ex-partner claimed not being told and used or threatened to use this law to sue his ex-lover as a revenge. Other cases that might seem unreasonable are listed here, and sometimes the sentence can be as long as more than 10 years despite medical testimony. The major argument against this law from the community is why target HIV only, and many hope this special law can be removed. But politicians and the lawmakers in Taiwan still think HIV is a special disease that warrants extraordinary control measures and regulations. So such campaign has not been successful. More recent argument centers on the enforcement of the law. They argue that with the new evidence such as U equals U, safe or unsafe sex should not be defined exclusively with condom use. But the court rarely recognizes this new evidence. So even if a person has been on ART and has undetectable viral load for many years and did not result in any transmission, the person's condomless sex will still be legally viewed as unsafe sex and punishable. Actually, in Taiwan, community and professionals have been advocating for U equals U in the past few years. But the laboratory-based concept was difficult to digest by the public, even for medical journalists. This year, thanks to COVID-19 messaging and live stream press conference on a daily basis, every folk suddenly became virologists. I could hear bus drivers talking about PCR 2 negatives, 3 negatives, false positive, false negative, or re-positives. People became very familiar with those laboratory terms. So even the term undetectable equals untransmissible, which is U equals U, is easy to digest now. In August this year, Taiwan CDC even officially endorsed the concept and published the first official material. While U equals U became more and more widely accepted by the public, in May, when the COVID-19 response was still ongoing, several young opinion leaders in the key population decided to launch a petition on Article 21. The rule of a petition in Taiwan is that you have to gather more than 5,000 supporters' online signatures within 60 days, and the government will have to answer your call publicly. Although the supporters were not many in the first month, when social media campaigning began in the second month, especially the final 2 weeks, this petition surprisingly won widespread support from many young opinion leaders, including famous YouTubers and politicians. The goal of more than 5,000 supporters was reached in July successfully. And interestingly, we found that COVID-19 messaging laid ground of this petition's success, not only scientifically, but also from a humanity perspective. The campaigners and supporters could conveniently quote some of the most famous phrases that already appeared in COVID-related local events, such as Petition said he felt extremely guilty, and the Minister of Health responded publicly by saying no one wants to be infected, patients should not feel guilty. The petition supporters related those quotes and applied them to HIV decriminalization. These kinds of empathy build-up has become a unique social psychological phenomenon because of COVID response. Taiwan CDC's official response to the petition is positive. We agree for regulatory change to include ART and viral load as scientific evidence and legal criteria affiliated with Article 21. Since July, materials about U equals U have been provided to the system of prosecutors and courts as supplemental guidance, and the reception has been good. Although I think it may take years before Taiwan totally achieves HIV decriminalization, this official endorsement of U equals U is an important beginning step, which I think is an amazing byproduct from the COVID response, thanks to a much broader public understanding and deeper empathy on infected individuals. If that's also something happening in your country, maybe you can use the momentum to move forward challenging agenda like what has happened in Taiwan. Thank you.